Why I keep showing up to physician conferences, even though I'm just a dentist. I was one of 2 dentists in a room of 3,000 physicians. That tells you something about how disconnected medicine and dentistry still are. For years, I attended training through A4M, the American Academy of Anti-Aging Medicine. Their approach is simple to describe, harder to practice. Stop waiting for disease to show up and then managing it. Instead, look for what's actually driving illness in the first place and treat the whole person, not just the isolated part that hurts. That idea reshaped how I think about dentistry. A4M would bring together 3,000 to 5,000 physicians in Las Vegas or other convenient cities and set aside an extra day just for dentists. Only a handful of us ever showed up. One year, I sat in a session led by a doctor from Germany named Hans Lammers. He was talking about mineral contamination in German soil from decades of war, and how he was working with couples struggling with infertility, tracing their health problems back to environmental exposures nobody else was considering. The physicians in that room had never heard anything like it. Neither had I, really, until I started attending these conferences. I don't give medical advice in my office. That's not my role, and I'm careful about that line. But sitting in rooms like that changed how I think about the patient in my chair. It's why I ask about sleep, inflammation, chemical sensitivities, and materials, not just teeth. The mouth doesn't exist in isolation, and neither does the rest of the body. That's the whole point of whole person care. And it's why, even after decades in dentistry, I keep showing up to learn.